PDF?
Yes, sir. Yes.
Okay. So we'll start with Unit 4, Diseases and Disorders of Various Body Systems, Part 1. So, introduction. Even in this highly advanced diagnostic and therapeutic era, the understanding of the basic mechanism of most diseases is still not clear. The term pathophysiology pertains to the study of causative factors involved in the common diseases affecting the human body. So, what are the objectives of this unit? After reading this unit, you should be able to discuss the role of inflammation in the body as a protective response, describe the process and outcome of inflammation and cell injury in the human body. Then third one is elaborate on various methods adopted by cells in the human body after injury and in order to adapt to the changed environment, and describe some important communicable diseases affecting humans and their mode of transmission. So first we'll start with inflammation. What is inflammation? Cells damaged by microbes, physical agents or chemical agents either initiate a defensive response called inflammation, or they can undergo adaptation. So cells damaged by any external factors can be damaged by any uh, physical agent or chemical agent, or they can go any adaptation, and the defensive response is called as inflammation. The four characteristic signs and symptoms of inflammation are redness, pain, heat, and swelling. So there will be four things: redness of the skin or any tissue, pain, heat means the temperature will be higher than normal, and swelling. Inflammation can also cause, depending on the site and extent of injury, the loss of function in the injured area. It can cause loss of function in the injured area. Inflammation is a protective attempt by the organism to remove the injurious stimuli and also to initiate the healing process. So it is important in the healing mechanism of the body. As you will read in this unit, inflammation traps microbes, toxins, and foreign material at the site of injury and prepares the site for tissue repair. So there are various mechanisms through which tissue repair occurs, and one of the basic mechanism is through inflammation. Thus, inflammation helps restore tissue homeostasis. Inflammation is not synonym with infection. Even in cases where inflammation is due to infection, it is incorrect to use the terms as synonyms. They are not same. Infection is caused by exogenous or any outside pathogen, while inflammation is the response of the organism to the pathogen. So exogenous response is called as inflammation. Now, inflammation can be divided into two types: acute inflammation and chronic inflammation. First, we will see the acute inflammation. Acute inflammation is short lasting, ranging from minutes to a few days, as seen in the case of throat infections, bruises, cuts, etc. Acute inflammation is the initial response of the body is the initial response of the body to harmful stimuli and is achieved by the increased movement of plasma and leukocytes from the blood into the injured tissue. So the WBCs are the main factor in repairment of the body and to fight against any infection. The fluid exudation moves into the extravascular space and also into tissue, causing edema, which is manifested as swelling, that is tumor during the inflammation. Some of the chemical mediators are bradykinin and increased sensitive pain, which is hyperalgesia. There are various mediators like histamine, serotonin, arachidonic acid derivatives, prostaglandins, leukotrienes, platelet activation factors, cytokines, which help in mediation of inflammation. Now we come to outcome of acute inflammation. Short-term inflammation is called as acute inflammation. The possible outcomes of acute inflammation are resolution, in which it is complete restoration of tissue after an episode of acute inflammation. Suppuration, this is formation of pus in the region of inflammation. Pus is a mixture of living, dying and dead neutrophils, bacteria and cellular debris, and a small amount of lipid. And third is organization. This is replacement of inflamed and damaged tissue by granulomatous tissue. So the possible outcomes can be three: resolution, suppuration, and organization. Now we come to chronic inflammation. While acute inflammation is characterized by simultaneous destruction and healing of the tissue by inflammatory processes, in chronic inflammation, however, the duration of inflammation extends longer than acute inflammation, and so it is referred to as chronic inflammation. Chronic inflammation is of four types: serous inflammation, fibrinous inflammation, suppurative inflammation, and ulcerative inflammation. It is similar to the types of acute inflammation only. Now we come to cell injury. The injury or sickness of the cell in any form due to either external physical mechanical trauma like atmospheric pressure, thermal, ultraviolet light, ionizing radiation. This is the first form of cell injury. Second is by chemicals and toxins like poisonous herbicides, microbial agents like bacteria, viruses, fungi, then nutritional causes like lead poisoning, internal causes like enzyme defect due to genetic makeup, for example, galactosemia, which is a hereditary disease caused by the lack of liver enzyme required to digest sugar galactose. Then there can be deficiency of vitamins and hormones. Then there can be ischemia, that is reduced blood supply to the tissue. Then there can be immune mediated mechanisms caused by chemical, physical, or microbial agents and can lead to reversible or irreversible loss of function or structure. So finally, we can see that there can be reversible loss of cell injury or irreversible loss of cell injury. So this, depending on the nature of this injury, the cell may either respond by increasing or decreasing the level of activity. When injury is sublethal or not killing, but the extent of damage is too severe and proteins of the cell are markedly damaged, the cell go for apoptosis, which is process of programmed cell death that occurs in the multicellular organism by activation of proteins called apoptotic proteins. So they can go for apoptosis. Now free radicals are atoms or molecules with an unpaired electron in their outermost orbit. As a result, they are highly reactive and unstable. Physiologically, these reactive species are quenched, means satisfied or suppressed by antioxidants like superoxide dismutase, catalase, peroxidase, etc. So normally these free radicals are neutralized by these enzymes. These reactive species can initiate a series of reactions that have irreparable effect on cellular macromolecules like lipids, proteins and DNA, etc. As a result, the cytoskeleton of the cell may get damaged or the ability of the cell to synthesize proteins may be lost. Now, cell death or cell destruction can occur in the following two ways. Death of cell may occur as secondary effect after an injury, or there can be programmed cell death or apoptosis. This occurs by activation of apoptotic proteins that lead to the release of hydrolytic enzymes from the lysozymes that digest the intracellular components of the cell. So it is like a mass suicide of the cell. Now, cellular adaptation. If the extent of injury after a harmful stimulus is repairable, then the affected cell adapts in various ways to the changes brought about in its surrounding environment. There are several adaptations adopted by the damaged cells, and these cellular adaptations are as follows. So, adaptations can be of many types. It can be hypertrophy. In hypertrophy, there is an increase in the cell size due to an increase in the number of intracellular organelles. So there is increase in the cell size, then it is called as hypertrophy. Say for example, liver hypertrophy. If the cells of the livers increase in size, there can be increase in the size of liver itself, and that will be called as liver hypertrophy. Then there can be hyperplasia. Hyperplasia involves an increase in the number of cells and occurs in those organs where cell division is possible. So there can be hyperplasia in which the cell size is not increasing, but the number of cells are increasing. That is called as hyperplasia. Then there is atrophy. Atrophy refers to the decrease in size of the cells in an organ. The shrinking of the ovaries after menopause and atrophy of skeletal muscles after prolonged paralysis of a limb are examples of atrophy. There can be hypoplasia. Hypoplasia means the reduction in number of cells, which in turn leads to decrease in the size of the organ. So hypertrophy and atrophy are opposite to each other, and hyperplasia and hypoplasia are opposite to each other. Then there can be metaplasia. Metaplasia is a condition where one type of cell converts into another type of cell. A common example of this condition is the development of Barrett's esophagus, where the normal stratified epithelium is replaced by gastric epithelium due to constant injury from the gastric acid. So, if the type of the cell is changed, it is called as metaplasia. And sometimes this can be carcinogenic. Communicable diseases. Communicable diseases are known as contagious and infectious diseases. In these diseases, the pathogens or pathogenic organism that causes the disease is called as causative organism. For example, tuberculosis. The causative organism is Mycobacterium tuberculosis bacteria. The causative pathogens may be unicellular microbial organisms like viruses, bacteria, fungi, protozoa, or multicellular organisms like parasites. These pathogens are able to cause diseases in animals, including us, because of their potentiality of transmission from one person or species to another. So, it can be waterborne diseases, airborne diseases, vector-borne diseases, or diseases spread through contact with the infected person. First of all, waterborne diseases like cholera, typhoid, dysentery, amoebiasis are the common diseases that spread through water that has been contaminated with human excreta and other organic impurities from animal and vegetable sources. First, we come to cholera. Cholera is caused by Vibrio cholerae, and transmission of cholera in humans occurs through the intake of water or food contaminated with the causative organism of cholera, that is Vibrio cholerae, and it will cause frequent vomiting and stool means diarrhea. Then typhoid. Typhoid or enteric fever is caused by bacteria Salmonella typhi, and it will also cause diarrhea and vomiting in the person. Then dysentery. Dysentery is of two types. Dysentery due to bacteria which is caused mainly by the rod-shaped bacteria Shigella, and amoebic dysentery caused by animal protist or protozoa, the amoeba called Entamoeba histolytica. So in this, the stool will be having blood also. Diarrhea is caused by single-celled protist organisms like Giardia or Proteus or Clostridium species. Now we come to hepatitis. Hepato means liver. Hepatitis or hepatitis implies injury to liver characterized by presence of inflammatory cells in the liver tissue. Some waterborne diseases caused by helminthic infections. Parasitic helminths that infect human beings are found into three groups of helminths. It can be nematodes, it can be cystodes, and it can be trematodes. So there are different types of worms which can infect the body and cause various diseases. Now we come to airborne diseases. Various modes of transmission of airborne disease are as follows. The disease may affect a person who comes in contact with the sputum or other discharges of the infected person suffering from the disease, that is carrier state. The disease may affect a person who comes in contact with the droplets that are expelled by the infected person when he coughs or sneezes, or it can transmit by using utensils used by the infected persons, or directly inhalation of dust contaminated with discharges of a patient, or contaminated with sputum, mucus, or phlegm mixed with saliva spat out from the mouth in the form of spit by the patient. So it can be by sputum, by droplets, by using utensils, or by inhalation of dust. Some airborne diseases are, the best example is tuberculosis. Tuberculosis is a bacterial disease caused by Mycobacterium tuberculosis. Nowadays, TB generally affects immunocompromised where immune system is not working properly patients like HIV patients. So it can cause various symptoms like persistent cough, severe weight loss, rapid pulse, afternoon fever, and anorexia. Then pneumonia. Pneumonia is an inflammatory illness of the lung. It is often described as lung parenchymal alveolar inflammation in which there is abnormal filling of alveoli with the fluid. Pneumonia is usually caused by bacteria Streptococcus pneumonia. There can be another organisms also, but most common is Streptococcus pneumonia. Then we come to chickenpox. Yes, chickenpox is also a respiratory infection also. Chickenpox is a highly contagious illness. It is a viral infection caused by varicella zoster virus, and it can cause various symptoms like rash and fever. Chickenpox is rarely fatal, although it is generally more severe in adults than in children. The most common late complication of chickenpox is shingles, in which a painful skin rash with blisters develops in a limited area on one side of the body, often in a stripe pattern. No specific treatment is required for chickenpox infection. The infection resolves in a couple of weeks itself. Then there are influenza. Influenza is a viral infection caused by different strains of influenza virus, and the symptoms are like fever, chills, severe body ache, inflammation of respiratory organs, and ache. Now we come to vector-borne diseases. Transmission of vector-borne diseases is governed by complex interactions between the parasite and the vector and the person infected or the host. A disease that is transmitted to humans or other animals by a vector is called as vector-borne diseases. Best example is malaria. Malaria is a vector-borne infectious disease caused by parasitic protozoan of the genus Plasmodium. Four types of Plasmodium parasite can infect humans, of which the most serious disease is caused by malaria parasite Plasmodium falciparum, which causes brain malaria that may be fatal. The most common type of malaria is caused by protozoa Plasmodium vivax, which is non-fatal. The other two types are Plasmodium ovale and Plasmodium malariae, which can also affect humans. The female Anopheles mosquito is the vector which is responsible for spreading malaria. So it should be noted that female Anopheles mosquito is not causing malaria. It is just spreading malaria. Causes of malaria is Plasmodium. When a female Anopheles mosquito bites an infected person, a small amount of blood is taken in by it. This contains microscopic malarial parasites. Before drawing up the blood, the female mosquito injects a small amount of salivary fluid into the punctured wound to prevent blood from clotting up. After 1 week later, when the mosquito takes its next blood meal, these present inside the mosquito mix with mosquito saliva and are injected into the person being bitten and who gets infected by the parasite. So, female Anopheles mosquito basically injects the parasite into our body when they are taking the blood meal. Next common and very important infection is dengue. It is dengue. Dengue fever and dengue hemorrhagic fever is a viral infection caused by related virus, a group of virus of genus Flavivirus. Dengue is spread by the bite of mosquito Aedes aegypti, which feeds during the day also. So malaria was caused by Anopheles, and dengue is transmitted by Aedes aegypti. Now we come to filariasis. Filariasis is a parasitic infection caused by nematode parasite Wuchereria bancrofti and Brugia malai. It is transmitted from one infected person to another by the bite of female culex. The third type of mosquito is culex. mosquito, which is the vector for this disease. Filariasis disease is characterized by recurrent attacks of fever and development of swellings of the legs, hands, and scrotum. The swelling is produced by the development of microfilaria, that is juvenile larvae or young ones in the lymphatic system. As a result, drainage is obstructed and there is development of solid edema in the organs. Therefore, this disease is also known as elephantiasis because there is excessive swelling of hands and foot. Now we come to plague. Plague is a deadly infectious disease caused by bacteria Yersinia pestis or Pastula pestis. Without treatment, it has a mortality rate of 70%, so it is quite high. Plague is carried by rodents, primarily rats, and spreads to humans via rodent fleas, which are the vector for the disease. So, rat flea or rodent flea is the main vector for plague, and the causative agent is Yersinia pestis. Now we come to rabies. Rabies is a fatal viral disease of the central nervous system caused by the rhabdovirus Lissa virus species, which affects humans and other mammals also. The disease causes acute encephalitis, that is inflammation of the brain. Another name for disease is hydrophobia, which literally means fear of water, which is a symptom shared by half of all the people infected with rabies. The common form of transmission of rabies is bite by a rabid, that is infected an animal by rabies virus, mammal like dogs, cats, monkeys, etc. So dogs, cats, or any wild animal which can be infected with rabies virus are the transmitting factor for rabies. Rabies can be prevented both in humans and other animals by vaccination, but successful treatment after development of disease is rare, and so if the infection develops, death is the most common outcome. Diseases spread through contact. Transmission of diseases through contact, as the name suggests, requires some form of touch to spread the infection. Modes of transmission of contact disease can be direct contact or indirect contact. Direct contact transmission, which involves immediate contact between two people or with animal, or indirect contact transmission that involves spread of disease by fomites. Fomites refer to an object that becomes contaminated by touch and then spreads the infection by touch. So fomites can be anything: pencil, pen, handkerchief, bottle, table, chair, anything can be a fomite. Some important diseases that are spread by physical contact and are discussed in this unit are scabies, athlete's foot, leprosy, venereal, or sexually transmitted diseases. First, we come to scabies. Scabies is a common skin infection and is usually transmitted by skin to skin contact or through sexual contact with someone else who is infected by it. So we come to scabies, which is caused by Sarcoptes scabies. Now we come to next disease, athlete's foot. Athlete's foot is a disease caused by parasitic fungus. The fungus infection causes scaling, flaking, and itching of the affected skin. We come to the next important disease, that is leprosy. Leprosy, also called as Hansen's disease, is one of the oldest disease fatal to the mankind. It is chronic disease caused by bacteria Mycobacterium leprae and Mycobacterium lepromatosis, that is only causative agent of diffuse lepromatous leprosy, which can be lethal. Now leprosy can be divided into two types: tubercular leprosy and lepromatous leprosy. Tubercular leprosy, which is non-infective and is characterized by an anesthetic patch where sensation of feeling is lost. But lepromatous leprosy, which is infective stage of leprosy and is characterized by the presence of infective nodules on the skin. Now we come to sexually transmitted diseases. There are several organisms that are transmitted by sexual contact. A sexually transmitted disease or venereal disease is an illness that has a significant probability of transmission between humans or animals by means of sexual contact, including vaginal intercourse, oral sex, or anal sex. Some diseases that are transmitted by sexual route are syphilis, gonorrhea, and AIDS. Syphilis is a dangerous and life-threatening bacterial disease caused by bacteria Treponema pallidum. Syphilis in patients is diagnosed by the detection of microorganism or the detection of antibodies in the blood. In its early stages, syphilis can easily be treated with antibiotics. Then there is gonorrhea. Similar to syphilis, gonorrhea is caused by bacteria Neisseria gonorrhoeae. Then we come to AIDS, that is acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome or AIDS is a potentially lethal sexually transmitted disease and is caused by a retrovirus known as HIV, human immunodeficiency virus. It can be spread either through the secretion of reproductive organs during intercourse, sharing the same needles, or during blood transfusion and transplacental transfer from mother to fetus. HIV invades and destroys the immune system, which protects the body from infection, and so AIDS is characterized by a rapid fall in CD4 lymphocyte count in the blood. Since these lymphocytes are responsible for maintenance of immunity of an individual, the person becomes immunocompromised and susceptible to other opportunistic infections like TB, herpes infections, parasitic infections of the GIT, etc., and may die from diseases that are harmless to healthy people. So, because of immunodeficiency, there is acquirement of different opportunistic infections. Now we come to Unit 5. Unit 5 is Disease and Disorders of Various Body System Part 2. In this we will study about objectives of this unit is list and describe the various diseases of the cardiovascular, digestive, respiratory, nervous, endocrine, and urinary systems, and discuss the main feature of the various diseases affecting the eye, sex organs, and neoplasms. Neoplasms are basically cancers. Disorders of the cardiovascular system. The cardiovascular system, as you will recall, consists of blood, heart, and blood vessels. So the most common disorder of cardiovascular system is hypertension or high blood pressure. Hypertension is a chronic condition characterized by an increase in systolic pressure over 140 millimeter of Hg and diastolic blood pressure over 90 millimeter of Hg. Now we come to hypotension or low blood pressure. When there is systolic blood pressure less than 100 millimeter of Hg and diastolic pressure to less than 60 millimeter of Hg, it is called as low blood pressure. Now we come to myocardial infarction, which we normally say as heart attack. Myocardial infarction is an ischemic necrosis, that is premature death of living cells and tissues of a part of the myocardium of the heart. So due to blockage of the blood flow in the heart, there is myocardial infarction or heart attack. Then we come to angina pectoris. Angina pectoris is a pain syndrome associated with myocardial ischemia in which there is partial obstruction of blood flow in the coronary or heart arteries in the heart. Arteriosclerosis. Arteriosclerosis is a disorder associated with loss of elasticity and narrowing of the lumen of the arteries due to thickening of the walls of the arteries, and it will render with hypertension. Congestive heart failure. Congestive heart failure is characterized by a decreased blood flow to various organs of the body due to failure of pumping action of the heart. Then we come to arrhythmias. Arrhythmias or dysrhythmias is a general term that refers to an irregularity in the heart rhythm or heart rate resulting from a defect in the electrical conduction system of the heart. Now we come to disorders of digestive system. It can be a disorder of gastrointestinal tract and disorder of accessory digestive organs. Constipation. The first important disease is constipation. Constipation is a condition characterized by infrequent or difficult defecation caused by decreased motility movement of the intestines. Diarrhea. Diarrhea is a condition characterized by an increase in the frequency of loose or liquid bowel movements or defecation. It also causes an increase in the volume and fluid content of the feces. Diarrhea is caused by increased motility of the intestine and the decreased absorption by the intestines, which results in the passage of poorly formed stool. Then there is nausea and vomiting. Nausea is distressing feeling prior to vomiting. The feeling may arise due to psychological stimulation, irritation of the upper GI tract, and vomiting is the sudden expulsion of gastric contents of the upper gastrointestinal tract through the oral cavity or the mouth. Then there is gastritis. Gastritis is an acute or chronic inflammation of gastric mucosa due to exposure to an irritant or infectious organism. Peptic ulcer. Peptic ulcer is characterized by ulceration of the gastric or duodenal mucosa of the GI tract, means ulcer in the stomach or duodenum. The causative agents of peptic ulcer are excessive gastric acid secretion or a bacteria called as Helicobacter pylori and consumption of irritant substances and drugs like aspirin. Hemorrhoids. Hemorrhoids are commonly called piles. This condition is characterized by presence of dilated varicose veins in the rectum or around the anus and loss of blood. Now we come to disorders of respiratory system. It can be upper respiratory system or lower respiratory system. Chain Stokes breathing. Chain Stokes breathing is a condition characterized by repeated cycles of irregular breathing that begins at first with shallow breaths and then increases to periods of rapid deep breathing followed by a period of 15 to 20 seconds of no breathing. Cheyne-Stokes breathing is normal in infants, but if it is occurring in adults, it is abnormal and it is a condition of respiratory disease. Dyspnea. Dyspnea is defined as difficulty in breathing. So various conditions can lead to dyspnea. Asphyxia. Asphyxia is a condition that arises due to oxygen starvation or due to decrease in oxygen in the blood. Cyanosis. Cyanosis is a condition characterized by bluish discoloration of the skin, which can be seen easily in the nail beds and mucous membranes. Then apnea. Apnea is temporary cessation of the respiration. It is generally seen in Cheyne-Stokes breathing. Then pneumonia, which we discussed in previous unit also. Pneumonia is an acute infection or inflammation of the alveoli, that are the alveolar spaces of the lungs. Pneumonia causes dyspnea and improper oxygenation of the blood. Then we come to bronchitis. Bronchitis is the inflammation of bronchi of the lungs due to microbial infections. Asthma. Asthma is a disorder characterized by chronic airway inflammation, airway hypersensitivity to a variety of stimuli, and airway obstruction. Now, disorders of nervous system or neurological disorders. Schizophrenia. It is a functional disorder of nervous system and is characterized by split personality. Mania. Mania is also a functional disorder in which the individual shows extremely elevated mood, energy, unusual thought patterns, and sometimes psychosis when suffering from abnormal condition in the mind. Then Parkinson's disease. Parkinson's disease or Parkinsonism is a progressive neurodegenerative disorder of the central nervous system due to degenerative changes in the basal ganglion in the brain. Then another disease is Alzheimer's disease, also known as Alzheimer's, is a neurodegenerative disease characterized by progressive cognitive thought process deterioration together with declining activities of daily living and neuropsychiatric symptoms or behavioral changes. The most striking or early symptom is loss of short term memory or amnesia. Convulsions. Convulsions is a condition characterized by involuntary spasmodic contractions of the skeletal muscles. Epilepsy. Epilepsy is a chronic disorder of the nervous system characterized by brief, unprovoked episodes of seizures. Meningitis. Meningitis is caused by infection due to bacteria like streptococci, meningococci, Haemophilus influenza, etc. The infection causes the inflammation of the meninges of the brain, which results in high fever, severe headache, stiffness in neck, nausea, vomiting, and visual and auditory disturbances. Viruses that can cause meningitis are enterovirus, herpes simplex virus type 2, varicella zoster virus, etc. Then encephalitis. It is associated with pathological changes in gray and white matter of the brain. Symptoms of encephalitis are similar to that of meningitis. Polio. Polio or poliomyelitis is a condition resulting from destruction of upper motor neurons by a virus, that is poliovirus. This causes paralysis, wasting of skeletal muscles which are supplied by the affected neurons, and acute inflammation of the brain. Polio has been eradicated from India in 2014, and still we are giving the vaccine so that it doesn't reoccur again in the future. Then narcolepsy. It is a neurological condition characterized by excessive daytime sleepiness. Then we come to disorders of eye or ophthalmology. Diffraction of light rays. You will recall that when light rays travel through a transparent substance such as an air and passes into a second transparent substance, then that has a different density, like example water, then the light rays bend at the junction point between the two. This bending is called as refraction. So it is a physics that is called as refraction. In the eye, similarly, when the light rays enter the eye, they are refracted at the anterior posterior surface of the cornea. Both surfaces of the eye further refract the light ray so that they come into exact focus on the retina. So it is refracted by the eye, cornea, then lens, and from the aqueous humor to vitreous humor to the retina. Errors of refraction. The normal eye is called as emmetropic eye. The errors of refraction that occur in eye can be myopia, hypermetropia, and astigmatism. Myopia is also known as short-sightedness. Myopic individuals can see nearby objects clearly but have trouble seeing far away objects clearly. So in myopia, the object is seen before the retina, so we need lens so that it can correct the defect and we can see the image properly in the retina. Then hypermetropia is also known as hyperopia or farsightedness. People suffering for hypermetropia have difficulty in seeing nearby objects clearly. In this, the image is formed away from the retina. Astigmatism is another error of refraction in which the rays are not sharply focused onto retina. This defect is either due to lens or cornea having an irregular curvature or curve. Then, very important disease is cataract. Cataract is a disorder arising visually in the old age but may also occur due to injury, excessive exposure to ultraviolet rays, and some medicines, long term use of steroids, or complications due to some disease like diabetes. In this disorder, the lens become opaque and so become cloudy. The only corrective treatment is through the surgical removal of the opaque lens, and after that use of glasses or implantation of an artificial lens. So, cataract, which is the most common cause of blindness in India, should be treated properly by replacing the opaque lens with an artificial lens. Then there is glaucoma. Glaucoma is a major cause of blindness and so is a serious condition. It arises from an increase in intraocular tension in the eye due to buildup of the aqueous humor within the anterior chamber. So if the pressure in the anterior part of the eye is increased, it leads to glaucoma. Then there is conjunctivitis or pink eye, is an inflammatory condition of the conjunctiva, the outermost layer of the eye that covers the sclera of the eye. It can cause redness of the eye and itching of the eye. Color blindness. Color blindness is a genetic disorder arising due to defect in the cone cells present in the retina of the eye. As a result, the person is not able to distinguish certain colors. Night blindness. Night blindness or nyctalopia is a disorder arising from a defect in the rod cells located in the retina, and the person will not able to see in dim light. This is a common condition in vitamin A deficiency also. Now, disorders of endocrine system. First, disorders of anterior pituitary. Hypersecretion of growth hormone in the child can lead to gigantism, that is abnormal increase in the length of long bones. Hyposecretion of the growth hormone in childhood can lead to dwarfism, or in which the patient is below normal height. Then disorders of thyroid gland. Thyroid gland dysfunction can be classified into hypothyroidism and hyperthyroidism. Hypothyroidism is a condition which develops due to deficiency of thyroid hormones. In childhood, hypothyroidism leads to development of cretinism, which is associated with stunted growth, bloated face, and decreased IQ. In adults, hyposecretion of thyroid gland leads to development of myxedema and goiter. Myxedema is characterized by puffy face with dry skin, scanty hair, tendency to weight gain, and slow heart rate, low blood body temperature, and dulling of mental functions. Goiter is a condition of hypothyroidism in which there is swelling of the neck due to enlargement of the thyroid gland because of compensation of decreased hormone production. So, because there is decreased hormone production, thyroid hormone, thyroid gland becomes hypertrophied and it increases in size, and that is called as goiter. Then hyperthyroidism. There are many reasons that can cause hyperthyroidism or increased production of thyroid hormones, like follicular cancer of the gland and Graves disease. Graves disease is an autoimmune disorder. A primary sign of Graves disease is enlargement of thyroid and peculiar edema behind the eyes, which causes the eye to protrude. Increases of the curvature of the eye outside the eyelids. Disorders of adrenal glands. First one is Addison's disease. Addison's disease is also called as chronic adrenal insufficiency or hypocorticism. Cushing syndrome. Increased secretion of cortisol hormone by the adrenal cortex is Cushing syndrome. Pheochromocytoma. Pheochromocytoma is a disorder that develops due to benign tumor of the chromaffin cells of adrenal medulla called pheochromocytomas of the adrenal medulla. Then disorders of pancreas. Hypoglycemia is a condition associated with an increased production of insulin by the pancreas. Then hyperglycemia is a condition arising due to decreased production of insulin or due to ineffectiveness of insulin on target cells. Hyperglycemia is a condition that occurs in people suffering from diabetes. Now, disorders of sex organs. Well, first, disorders of male sex organs. Hydrocele. Hydrocele is a condition in which there is accumulation of fluid in the scrotum. Then, prostatic enlargement. Enlargement of prostate gland commonly occurs in the elderly males. The enlarged prostate gland of the male reproductive system causes difficulty in passage of urine, urinary retention, and incontinence, that is, involuntary leakage of urine. It mainly occurs in elderly males above 60 to 70 years of age. Impotence. Impotence refers to inability of the male membrane to attain or sustain an erection that is satisfactory for normal coitus. The reason may be psychological, neurological, or pathological. Now, disorders of female sex organs. Mastitis refers to inflammation of parenchymal cells of the mammary glands, which may sometimes very quickly progress to an infection. It can be acute mastitis or chronic mastitis. Then ovarian cyst. It is most common form of ovarian tumor. Endometriosis, the disorder characterized by growth of endometrial tissues, that is inner uterine layer outside the uterus. Vaginitis, it is an acute inflammation of the vaginal mucosa leading to vulvovaginitis. There are several different kinds of vaginitis each with their own causes and symptoms like candida infection, bacterial vaginosis, trichomoniasis, or non-infective vaginitis. Then dysmenorrhea is a condition characterized by severe uterine pain during menstruation. Dysmenorrhea may coexist with excessively heavy blood loss, that is menorrhagia. Amenorrhea is a term that refers to absence of menstruation. Now, disorders of urinary system. First one is renal calculi or renal stones. Renal calculi, also known as renal stones. Renal calculi can vary in size from as small as grain of sand to as large as golf ball. Now, there is episodic pain in renal calculi, which may extend to other parts of the body, that is called as renal colic. Now, we come to cystitis. Cystitis is a term that refers to the inflammation of urinary bladder. Then there is glomerulonephritis. Glomerulonephritis is a type of kidney disease that involves the glomeruli of the kidney. In glomerulonephritis, the glomeruli become inflamed and impair the kidney's ability to filter urine. Then we come to uremia. Uremia is a term that loosely describes the metabolic disorder accompanying severe kidney damage that leads to kidney failure, renal failure, and as a consequence of uremia, the uric acid levels in the blood increases because they are not excreted via urine. Neoplasms. A neoplasm or tumor is a mass of tissue that has formed as a result of abnormal, excessive, and uncoordinated growth of cells. The branch of medicine that deals with neoplasm is called as oncology. Neoplasms can be either malignant or benign, that is harmless. Benign tumors are less damaging to the host and are localized, whereas malignant tumors are more aggressive and spread to different parts of the body, adversely affecting its normal functioning. Malignant tumors are also referred to as cancers. Now, we first come to benign tumors. Benign tumors have a well defined shape and generally spherical or ovoid in shape with a capsule around them. They do not invade adjacent tissues. Some example of benign tumors are uterine fibroid and skin moles. Yes, skin moles are also a type of benign tumors. Then we come to malignant tumors. Malignant tumors or cancers have irregular shapes and lack a capsule covering. Their margins show infiltration into the adjacent tissues. The cancer or malignant cells have the ability to undergo metastasis, or in the other words, spread to different parts of the body. Some examples of malignant tumors are leukemia, that is blood cancer, malignant melanoma, that is skin cancer, breast cancer, lung cancer, skin cancer. There can be different types of cancer. Etiology of cancer. So far, no single factor has been found to be responsible for the development of cancer. The development of cancer is in an interplay between various carcinogenic factors and body's innate resistance to development of neoplasms. Various factors like genetic predisposition, cigarette smoking, alcoholism, chemical carcinogens like benzene, vinyl chloride, asbestos, irradiation with ultraviolet rays, X-rays, have been implicated in the development of different neoplasm. Then treatment. At present, the treatment modalities of neoplasms include surgical removal of the tumor. For cancer, however, apart from surgical removal, radiation therapy and or chemotherapy with anti-cancer drugs are the lines of treatment that are used. The prognosis of any neoplasm depends on the severity and the type of neoplasm involved. Now we come to the sixth unit, that is disease and disorders of various body systems. In this, we will study about it. We will we should be able to enumerate different disorders of blood, discuss various disorders of skeletal systems and joints, the various vaccines used in prophylaxis of disease, and discuss the various immunization schedules. First, disorder of blood, and the most important is anemia. Anemia is defined as a qualitative or quantitative deficiency of hemoglobin, a protein found inside red blood cells. This may occur due to loss of RBCs during bleeding, destruction of RBC, or due to decreased production of RBC. Anemia is also caused by lack of iron in the body, that is called as iron deficiency anemia. So it can be iron deficiency anemia or hemolytic anemia. Iron deficiency anemia is the most common type of anemia and is caused by inadequate absorption of iron, excessive loss of iron, increased iron requirement, or insufficient intake of iron. Now, it can be megaloblastic anemia, in which it is caused by inadequate intake of vitamin B12 and folic acid. It can be pernicious anemia, which is form of vitamin B12 deficiency anemia. Hypoplastic or aplastic anemia. This type of anemia occurs due to varying degree of bone marrow failure. If the bone marrow function is reduced, it is hypoplastic anemia, and if the function is absent, it is called as aplastic anemia. Now, hemolytic anemia. Hemolytic anemia involves the destruction of RBCs in the blood or by macrophages in the liver and spleen. It can be autoimmune hemolytic anemia. In this type of anemia, antibodies are produced against the patient's own RBCs, causing destruction or hemolysis of the RBCs. Blood transfusion reaction is a type of hemolytic anemia. If a patient receives a blood possessing antigen different from its own, antibodies against this are produced in the body, and this may lead to hemolysis. For example, if any person having B blood group and that person is injected with blood A group, then there can be blood transfusion reaction or autoimmune hemolytic anemia. Then there is sickle cell anemia. In this disease, genetic abnormality leads to synthesis of abnormal hemoglobin. These abnormal hemoglobin molecules are misshaped when deoxygenated and gives a sickle shape to the erythrocytes. Then there is thalassemia. In this disease, there is reduced synthesis of globins, which causes further reduction of hemoglobin production and increased friability of the cell membrane of the RBCs. Anemia occurs due to early hemolysis. Then there can be normocytic anemia. This type of anemia occurs in many chronic diseases or after severe hemorrhage. In this type of anemia, the cells are normal but their number is reduced. Then there is leukopenia. In this condition, which in which the total blood leukocytes or white blood cells count is less than 4,000 millimeter cube. Then thrombocytopenia. In this, there is decrease in blood platelets, which come to less than 1 lakh per millimeter cube. It is mainly in diseases like dengue. Leukemia. The term leukemia refers to a group of bone marrow cancers which results in uncontrolled or increase in the production of white cells. Then varicose veins. In this condition, in which the vein becomes dilated and venous walls do not close to prevent backward flow of the blood. The veins lose their elasticity and become twisted in appearance. So most common varicose veins are in the legs, and these commonly occurs in traffic polices because they have to work standing in for many hours. Disorders of skeletal system and joints. Joint pain and inflammation may be caused by many things. Some inflammatory joint disorders cause pain and suffering. Example, arthritis, which describes many inflammatory or degenerative disease that damage the joints. Then disorders of skeletal system. Osteoporosis. It is a disease of bone that leads to an increased risk of fracture. In this disease, the bone mineral density is reduced and bone microarchitecture is disrupted. It is a condition of porous bones in the bone mass, that is amount of bone tissue is reduced because bone decay outpasses bone deposition. It is due to depletion of calcium from the body. So if the bone deposition is less and bone decay is more, it can cause osteoporosis, and further it can cause frequent fracture of the bones. Then there is rickets and osteomalacia. Osteomalacia is a general term for the softening of the bones. These are bone disorders in which bone fails to calcify. Rickets occurs in children and osteomalacia in adults. They are caused due to deficiency of vitamin D, either due to insufficient sunlight, lack of vitamin D, or malabsorption. Then there is myeloma. It is a rare disease that is fatal in most cases. It is characterized by presence of tumors in the bone or in the bone marrow. And fracture, a painful condition arising due to break in the continuity of the bone architecture. It is caused due to mechanical stress or trauma. Lordosis. This is abnormal anterior convexity of the spine. Kyphosis. This is angulation of normal posterior curve of spine. It gives rise to condition commonly known as humpback or hunchback. Now we come to disorders of joints. Arthritis, a form of inflammatory disorder characterized by changes in the joints that result in restriction of locomotion. On the basis of etiology, arthritis can be divided into mainly two types. Rheumatoid arthritis, it may be caused due to infection or idiopathic and is characterized by inflammation of the small joints. Osteoarthritis, more extensive involvement of the joints as compared to rheumatoid arthritis. It generally involves the weight bearing joints. Now, gout. Gout again is an important disease. It is a state of intermittent episodes of acute arthritis of peripheral joints. The uric acid is a waste product of metabolism of nucleic acid, that is DNA and RNA, and it is produced in excess when there is large scale cell destruction, such as destruction treatment with cytotoxic drugs, malignancy, and in anemia. Gout is caused by accumulation of sodium urate crystals in the joints and tendons. These crystals irritate and erode the cartilage and cause acute inflammation, swelling, and pain. Now we come to immunity. The term immunity refers to the resistance shown by the host towards injury caused by microorganisms and their products. When a microorganism comes in contact with host, various defense mechanisms of the body are activated. The ultimate aim of the defense system is to recognize, destroy, and eliminate the foreign material. Now, immunity can be mainly of two types: innate or natural immunity, and acquired immunity. Innate or natural immunity is the resistance to infections possessed by an individual at his genetic and constitutional makeup. Now, innate immunity can be species specific, racial specific, or individual specific. Now we come to acquired immunity. The immunity that is acquired by an individual during his life is called as acquired immunity. Acquired immunity is of two types: active and passive. And active and passive can further be divided into natural and artificial. Infection or by specific immunization is known as active immunity. Natural active immunity. It develops by a clinical or subclinical infection with a microorganism. So, by infection of my microorganism, the body starts making antibodies, that is called as natural active immunity. Artificial active immunity, this immunity is developed by vaccines. So, vaccines, if injected in the body, they form active immunity, artificial active immunity. Passive immunity. It is a type of immunity which is transmitted to a recipient in a ready-made form. In this type of immunity, the ready-made antibodies are given and recipient's immune system plays an no active role. So natural acquired passive immunity. Natural passive immunity is the resistance that is transferred from mother to baby. Mother antibodies are transmitted to fetus through the placental blood and give immunity to the infants for several months. Then there can be artificially produced passive immunity. In this, the immunity is produced by injection of immunoglobulins or antibodies. Now, active immunization and passive immunization. In active immunization, we mainly include vaccines, which may be toxoids or suspension. And toxoids are the toxic substances produced by any byproduct of metabolism of pathogenic microorganisms. They can be endotoxin or exotoxin. Passive immunization. Passive immunization can be further divided into two categories, that is antisera and immunoglobulin. Antisera can be further divided into four categories, that is antitoxin, antiviral, antibacterial and antivenomous. While immunoglobulin are like normal human immunoglobulin, hepatitis B immunoglobulin, rabies, measles, tetanus immunoglobulin. Immunoglobulins. Immunoglobulins are antibody preparations obtained from human plasma or serum. So they are like artificial antibodies. Immunization. Immunization is the process by which immune system of a human becomes fortified against an agent, that is immunogen. Immunization can be done through various ways, but the most common technique is vaccination. So there are different vaccines given under national immunization schedule. This is an older schedule, so you can download from internet the new schedule, the new national immunization schedule, and then you can read it, in which it is written where when the vaccines are given in children and pregnant women. So we have completed the 3 units which we have to complete today. I will stop sharing now. Any doubts till now? Hello, can you hear me? Hello.
Yes, you're audible, Dr. Saras. Learners,
Okay,
please
thank you.
respond.
Audible, sir. Audible.
Okay, I think the class was interesting and everything was uh, properly listened. If any doubts, you can ask, or otherwise, we will close for the day.
All good, sir.
Say,
All good, sir. Fine, sir.
all good? Okay. Okay, then thank you so much for listening patiently. We will meet tomorrow. Yeah, sure. Thank you.
Thank you.